Fellow South Africans, the National Coronavirus Command Council met yesterday to consider the recent rise in infections and the possible impact of Omicron variant. This meeting was followed by meetings earlier today of the President's Coordinating Council, which is attended, as you well know, by our premiers and members of the Coronavirus Council, as well as our metro mayors. There was also a cabinet meeting where a decision was taken that the country should remain on coronavirus alert level 1 for now, and that the national state of disaster should remain in place. In taking the decision not to impose further restrictions at this stage, we considered the fact that when we encountered previous waves of infection, vaccines were not widely available and far fewer people were vaccinated. This is no longer the case. Vaccines are now available to anyone aged 12 and above. They are free, and they are also available at many sites across the country. We know that they prevent severe disease and hospitalization. We also know that the coronavirus will be with us for the long term. We must therefore find ways of managing the pandemic while limiting disruptions to the economy and ensuring continuity. However, this approach will not be sustainable if we do not increase the vaccination rate, if we do not wear our masks, or if we fail to adhere to the basic health precautions. We should all remember that in terms of alert level 1 regulations, there is still a curfew in place from 12 midnight to 4 a.m. No more than 750 people may gather indoors, and no more than 2,000 people may gather outdoors. Where the venue is too small to accommodate these numbers with appropriate social distancing, then no more than 50% of the capacity of the venue may be used. No more than 100 people are permitted at a funeral and night vigils. After funeral gatherings and after tears gatherings are not allowed. The wearing of masks in public places is mandatory, and failure to wear a mask when required remains a criminal offense. The sale of alcohol is permitted according to the regular license conditions, but may not be sold during curfew hours. We will closely monitor infection rates as well as hospitalization over the coming days, and will review the situation in another week. We will then need to determine whether the existing measures are adequate or whether changes need to be made to the current regulations. We have started the process of amending our health regulations so that we can review the use of the Disaster Management Act to manage our response to the pandemic, with a view to ultimately lifting the national state of disaster.